Good afternoon, everyone. My name is Ludovica Colelli, and I am the Junior Events Coordinator and in-house translator of ISC. Today, I am here with Dr. Real, who is going to teach a workshop in Milan on June 30th and July 1st. That is titled Healing Trauma Through Connection to Ourselves and Others, an Introduction to RLT. Dr. Real, thank you so much for your time and for being with us today to allow this interview.
Thank you. Please call me Terry. I'm actually not a doctor.
Thank you so much, Terry. The aim of this interview is to allow mental professionals and especially Italian clinicians to know you better. So firstly, I'd like to ask you to better introduce your background. I know that you have founded the Relational Life Institute, RLI, which is dedicated to teaching the general public how to live relational lives and to teaching mental health professionals the practice of relational life therapy. Please just share with us a little about you.
Let's see. I've been married 38 years. I have two sons, 32 and 35. I am a psychiatric social worker by degree. I've been trained as a family therapist for 40 years. I've been teaching couples and family therapy for just about 40 years. I've written 4 books. My first book came out in the mid-90s. It's called I Don't Want to Talk About It. It was the first book ever written about male depression. Before that book, depression was seen as primarily a woman's disease. And I'm very proud of my role in bringing male depression out to the surface. I say that men experience and express depression differently, many of them, not all, than women. Women tend to internalize distress, men tend to externalize it. So you don't see the depression per se, you see what the man is doing to escape it. And many of sort of traditionally male problems, drinking, womanizing, rage, may have, not all, but often may have an underlying core of depression that the man is trying to self-medicate and escape. Underneath that core of depression is trauma. And I speak about patriarchy. I've been writing about patriarchy for 40 years. I talk about what I call normal boyhood trauma. Under patriarchy, the way we quote unquote turn boys into men is through disconnection. We teach them to disconnect from their hearts, from vulnerability, from others. We call that learning to be independent. And I write that the cost of disconnection in boyhood is disconnection as an adult. If you read the feminist literature on women, girls lose their voice, in Carol Gilligan's famous phrase, about the edge of adolescence. They stop telling the truth. They over-accommodate. And of course, feminism has been all about helping women recover their power and their voice. Boys lose connection. Do you know how old? You want to guess?
I'm not sure.
3, 4, 5 years old.
Oh.
Judy Chu has done a study. Boys before kindergarten already show statistically significant decrease in expression of emotion. They still feel it, but they know better than to say. And the essence of traditional masculinity is invulnerability. The more invulnerable you are, the more manly you are. The more vulnerable you are, the more girly you are, and that's a bad thing. But heterosexual women across the West are now insisting on levels of emotional intimacy from their men. Then patriarchy raises men to deliver. There's a disjuncture. And at least in the US, 75% of divorce is instituted by women. So I devised a way of working. What I believe, and it's in my first book, is that what ails men is being pushed out of relational connection. Relational connection by which I mean living an authentic, healthy connection to yourself, your wants, needs, feelings, and to others, to the planet, to spirit. This is what we're born to be as a species. Young infants connect within days. Our physical bodies thrive in connection. There was a recent study Gabor Mate quotes,